into the value and the experience these people get. There is a major challenge mainly in having many students placed in the health facilities without a master rotation. Sometimes you find the numbers of students are more than even the patients or even the healthcare providers. So you find some students could be joyriding, and at the end of it, their logbooks are signed, and yet they have probably not achieved the required skills during that rotation. The county personnel play a critical role in the training, but how much of the county personnel have been trained on assessing the students and imparting the knowledge? We know most of our healthcare providers probably may not have gone through training on medical education, but they are expected to train other healthcare professionals. We know also that doctors go for internship, and not only doctors, other healthcare providers go for internship in county health facilities, and they are supervised in these health facilities. But do we have a conversation between the trainers, the regulators, to discuss whether the training needs have been achieved and whether they have, the interns have realized what is required? Is there a time that the training institutions, the regulatory bodies, and the county governments meet to interrogate that the interns have actually achieved what they are supposed to achieve during the internship period? The county governments take overall responsibility for the welfare of the patients on whom the students undertake their practical training and for the actions of the students. In case of negligence or something that the students do to the patients, the healthcare professionals in these county health facilities are held responsible. We need to have dialogue on such issues in this moment where we have a lot of litigations. Earlier I talked about use of county health facilities and personnel for in-service training. We also have the in-service training, the CPD, that healthcare professionals are supposed to be undergoing. How sure are we that this in-service training meets the required level of standard? There are things probably that we just accept and agree that we have done in-service training, but really the standards of such training should be evaluated. Talking to the role of county governments in regulation of healthcare professionals, the availability, accessibility, acceptability, and quality of healthcare professionals are dependent on both the training and regulation of healthcare professionals, which are intertwined. For this reason, county governments ought to play a critical role, not only in training, but also in regulation of health professionals. This is more so since strengthening the health workforce through policy, adequate financing, planning, recruitment, training, deployment, and retention is key to ensuring access to qualified health workers. In Kenya, all cadres of healthcare professionals are regulated by their respective professional regulatory agencies. Thus, we need to look critically into the regulation of the health workforce, which involves accreditation of training institutions, which is done. But looking at what we have had, the dialogue that we have had, the issues that have been raised on the quality of training, in accreditation of training institutions, do we have adequate number of facilities? Do we have adequate number of training lecturers? You could find that, and even adequate number of training clinical placement areas. That also comes in with the indexing. Sometimes you find in institutions, I worked previously in the universities, and sometimes indexing could come towards the final year. This means that there is a gap, because why do we have to wait for indexing to the last final year, and probably the student may not have met the requirements before entering into that clinical profession. And the issue of clinical area and training institutions, sometimes we have a class of very many students doing one course, and this strains on the lecturers and also on the clinical areas. The county government too should have a say over the internship centers, and if possible too, the licensure exams, and also recording licensed professionals in the national registry. The regulatory bodies also oversee renewal of licenses and compliance with the mandatory continuous professional development, training requirements, disciplinary actions, and immigration and out-migration of health professionals. I want to speak into disciplinary actions. We know probably that we have the unions, we have the professional associations. When they defend one of their own in professional misconduct, how are we able to resolve this issue? Because you would see, having been at the Nursing Council once, it was evident sometimes that a case would not go through because the professional association would come out very strongly to defend one of their own. So we also need to look into professional associations and the people in those associations and unions, so that they are able to, as much as work on the welfare of the health professional, also look into the professional conduct and ethics. This data is critical. The data for the regulatory bodies is critical for use in improved workforce management and in planning. We know that there is joint inspection, and some of the staff of the county governments were trained and they inspect the health facilities. This is a good way forward because the standards have been clearly laid down, even though the standards may not be met because of the financial constraints. So there is need, as we talk about training and regulation of healthcare workforce, we also need to talk about healthcare financing, because you cannot train and regulate where they do not have the correct placement and they don't have the correct standards. We know the norms and standards are there, but we cannot meet that. Being in the county governments, if you see the standards of a dispensary or a health center, the requirements are very ideal. But looking into our system, our healthcare system, our Kenyan situation, we need more conversations on how much we can add into healthcare financing to achieve the universal health coverage. We know the upcoming diseases like COVID-19 even stretched our healthcare systems more. County governments should have a role in the accreditation of training institutions, setting of the minimum qualifications for admission, to undertake training in some of these professions. Sometimes you find that those staff going for training in certificate courses may not be required to have very good Form 4 grades, but we forget that while they are working, they are supposed to interpret, to use data. This means we compromise the capacity and we are not able to achieve the data. We're always talking about indicators, but if you have someone who cannot comprehend and interpret that data, it really undermines the quality of healthcare. The county governments should also should be involved in renewal of licenses and compliance. Of licenses and compliance and immigration and out-migration of health professionals. Sometimes the county government lose on the very well-trained health professionals that they have invested in. So the challenges, as the major consumers, employers of healthcare professionals and players in training of healthcare professionals, county governments have experienced a number of challenges. One, constrained financial resources. I have alluded to this earlier. Lack of adequate control powers over the interdoctors working under their supervision. Lack of consultation with county governments on the minimum addition qualifications for students being admitted in the medical training colleges. Lack of involvement of county governments in the development of the training curriculum to take into account the needs of county health facilities in the training programs, and then production of healthcare professionals that are not fit for purpose, necessitating retraining by the county governments. The way forward, there is need to approach training and regulation of healthcare professionals from an intergovernmental perspective that requires cooperation, collaboration, consultation, and coordination between national and county governments. Restructure the wages of the county personnel who play a role in the training of healthcare professionals to incentivize them. Rethink the resourcing of county governments for their role in training, supervision, consumables, postgraduate training. Promote collegiate systems for postgraduate training of specialized services through county health facilities to address the current problem that involves county governments continuing to pay personnel emoluments to health professionals on postgraduate studies undertaken in national county and teaching hospitals. And finally, promote county referral health facilities to serve as postgraduate training centers. Thank you very much for listening. I know probably you had undivided attention because I came in between your dinner. I think we apologize for that.
I wonder whether there's any question to the presenter. Yes.
Thank you, the presenter, for good presentation. I'm called Noel. I'm from Uganda. I'm the chairperson of Uganda Ladies Professionals Council. When I look at your presentation, it looks the role of county government is like the role of professional councils. I want to hear from the difference between the role of county government here and the role of professional councillors. The second question is, the county government have such capacity to control the CPD, the part of the training, such kind of that should be done by the professional council.
Do you get the question?
Yeah.
Prof, you have a question? Okay.
Wait, Tena, you again.
I'm afraid I was awake, but I'm afraid I found that presentation considering I found it a bit too strong. I found it more of a lamentation. A lot of the issues which you raised could have been sorted out by what you said at the very end, consultation. Some of the issues which were raised are not correct. Some of the issues you have got no legal mandate as it is to undertake. And I think we should go more into consultative discussion rather than abrasive confrontation.
Thank you. I think that's probably more of a comment. So, is your comment is the same as Prof's? Just come.
Thank you for this chance. I would like to reinforce Professor's position. We are a profession. When we say county government wants to control doctors, who is county government? What we know is that the county government of Kenya has been failing in its duty. You never talked about doctors going without salary for 6 months. You never talked about some doctors being chased because of different ethnic background. Medicine, nursing, all these are international programs. The county government has been born when these practices are going there. Who is the county government to come and control
Thank
an
you,
international organization?
Thank you, sir.
Please revise the presentation.
Thank you. I think those are very strong comments. People are angry. They are hungry. So let me. Diana, I hope it's one question, not a long one.
Thank you for the presentation, Dr. Rotich. My question is, because it sounds like there's an issue around stakeholder engagement, I've had that throughout yesterday and today. So do you have any recommendations of how we can strengthen meaningful stakeholder engagement so that some of these sentiments do not keep coming out? Thank you.
Yes, Lakati.
Thank you, Dr. Rotich. I want to agree with Professor here because I know that where I work, we actually get work with county governments and get MOUs and actually have a relationship. Of course, there are challenges. So my thinking is your presentation should have looked at what has worked well and areas of improvement as opposed to, the way it was presented. Thank you.
All right, Evelyn.
Thank you very much.
You only have 2 questions from the gentleman. The others are comments. And
thank you very much.
And Dr. Diana Mukami's question.
Thank you very much for the concerns too, but I don't think we should take our presentation very personal because this is actually what happens on the ground. I know we very much want to protect our professions, but with this conversation, we really have to discuss. And it's not that we want to control the doctors. The doctors work in the county health facilities. And what we are just saying, we need a safe doctor. We need a doctor who is well-trained, well-regulated, and understands their role in the healthcare facilities. So we don't want to come into aspects of defense, but this is what the county governments feel that there is a gap that needs to be addressed. And I agree with Diana saying there is need for more stakeholder involvement. what the county government is not asking to regulate. They just want to be involved in the regulation, to have their input, so that we have a healthcare professional who practices in the county health facilities and meets the needs of the people.
Yeah, so I think as Diana was saying, Evelyn is suggesting that county governments are stakeholders in the process. So I think probably that would be the answer. And there may be challenges, as people have said and as you have noted, but I think those are challenges that have been overcome in some counties. Some counties may still have them. And as my brother was suggesting, probably some of the counties may not have the capacity, but I think it's work in progress in terms of involving the counties as stakeholders. Thank you, Evelyn.
Thank you.
May we appreciate Evelyn for our presentation. Asanteni sana. I think that really marks the end of the presentations today. Have a great evening and see you tomorrow.
We are all right.